Hamilton.
Presiding officer. Well, we've listened to a number of very powerful speeches illustrating the catastrophe which is the Betsi Cadwaladr Health Board, over which the current Cabinet Secretary and the previous one, who's temporarily left the chamber, have presided now for many, many years. The Labour Party is accustomed to saying that the National Health Service is the envy of the world. Well, as far as Betsi Cadwaladr is concerned, I don't know which world they're thinking of. It must be the planet Pluto, because it certainly isn't the envy of anybody in this world of planet Earth. Michelle Brown raised a very important point in her speech earlier on, and that is the unresponsiveness of the Betsi Cadwaladr Health Board towards its patients with the complaints that they've made. We've had a massive number of individual examples that have been trotted out here this afternoon, and I make no apology for returning to a theme which I have raised in the chamber on several occasions since I was elected: the denuding of the Welsh uplands based around Blaenau Ffestiniog of any substantial health service provision. It's well over a year now since I asked the First Minister what the Welsh Government was going to do about this, given that Betsi Cadwaladr is in special measures. I said in Gwynedd in particular, in the area around Blaenau Ffestiniog, the record is exactly the opposite to that which the government claimed in its Taking Wales Forward document, section on health, where they said we're committed to helping improve health and well-being for all. What's happened in the Welsh uplands is entirely the opposite. In the 7 well-being areas defined by Gwynedd, there is a community hub hospital in every one apart from Blaenau Ffestiniog, because their 24-hour service was closed several years ago and downgraded to a 10-hour health centre, downgraded again since then. Since 2013, therefore, we've seen the closure of the hospital, loss of hospital beds, the closure of the X-ray service, closure of minor injuries unit, the closure of teledermatology clinics and therapy services. 2 rural branch surgeries are closed. The GP practice in Blaenau Ffestiniog was supposed to have 4 full-time doctors. It's only got 1 salaried doctor and a variety of locums. As far as Blaenau Ffestiniog is concerned, they haven't got a national health service. They've got a notional health service. And in the 14 months since I made that indictment to the First Minister, absolutely nothing has changed despite the special measures, and something has got to be done about it. Now, we all know, of course, that areas like Blaenau Ffestiniog and its surrounding district pose problems. There's always going to be a tension with the provision of health services in sparsely populated rural areas. But the models which have been chosen are more related to what is appropriate for urban areas rather than rural areas. In urban settings, of course, the tendency is, for very obvious reasons, to pull services together into community health care hubs. But in rural North Wales, it has been in the other direction. What we should be doing is pushing services into rural areas to gain the patient outcomes without too great a loss of financial efficiency. What we have seen is a very substantial expenditure of money in Blaenau recently, well over £1 million, I believe, but not a single bed is created. We've created dozens and dozens of desks for National Health Service pen pushers instead. So they closed the Memorial Hospital and replaced it with an office block. Now, that is not what we expect from a health service, and the poor residents of Blaenau and district deserve a great deal better than that. Other countries seem to be able to manage to do this. Why can't we? In the United States, rural areas have long enjoyed support and protection from the US Rural Health Clinics Service Act of 1977, and the Federal Office of Rural Health Policy and National Rural Health Association provide a mechanism for rural health campaigners to receive significant support in their interface with Congress. And we know that there is something called distance decay. There's the further away you live from a hospital, the worse the health outcomes tend to be, because people find it much more difficult to get to hospital, so they don't go for treatment in time and regularly enough. There are problems with poverty in rural areas. People have to pay to travel to hospitals which are a distance from their homes, so they don't have a free health service because it actually costs them a great deal of money often in order to get the treatment that they deserve. In Scotland, there are some more imaginative models than we've got here in Wales. For example, in the Isle of Skye, they have a model of rural practitioners where in the Broadford Hospital is staffed by GPs with additional skills and training in anaesthetics and trauma. The model was developed after consultation with the local community and the realisation that the size of their community, which was about 13,000, had a need for some emergency service that couldn't sustain a general hospital. Instead, the Broadford is now an enhanced community hospital. Why can't we do that in Blaenau? The previous health secretary refused to intervene in the closure of the hospital services in Blaenau because it was supported by the local community health council, because the local community health council is not elected by anybody in the area which is covered by the hospital closures. That's why we need to introduce the kind of democracy into the health service which Michelle referred to. I'm afraid I think I'm at the end of my speech, and the Deputy Presiding Officer would not allow me to accept an intervention, although I would have been otherwise delighted to do so. So I'm afraid that this catalogue of disaster continues, and I believe until we change the government of this country, it is likely to continue further.
Thank you.